States have had major problems with Obamacare exchanges. One of the worst, just up the road from here. Chief Washington correspondent James Rosen tells us what went wrong in Maryland.
And now everyone in Maryland will be able to find health insurance coverage that fits their needs through Maryland Health Connection.
Except it didn't quite work out that way.
You'll find the information clear and easy to understand.
In fact, Maryland's online exchange racked up one of the worst records of the 17 states that set up their own exchanges, reportedly enrolling just 9% of the state's pool of potential enrollees in private plans, well below the national rate, which was middling at best and stood at about 15%.
People get on the website, they don't know what their subsidies are going to be, whether they're going to get a subsidy, whether they can afford the insurance. They don't even know whether their doctor is going to be on the plan right now.
On the eve of Obamacare's open enrollment season, President Obama touted Maryland, where Democratic Governor Martin O'Malley presides over one of the bluest states in the nation, as a likely success story.
It's going to be smoother in places like Maryland, where governors are working to implement it rather than fight it.
Now, board members are expected to vote Tuesday to scrap Maryland's exchange, built and operated at a cost of $125 million, and use the consulting firm Deloitte to install the model used by Connecticut, which reportedly enrolled about 26% of its eligible pool in private plans. The additional cost could run to $30 million, but O'Malley argued Friday that Marylanders have seen great strides.
This was a ship that couldn't even get out of port. She's now under sail. We're signing up people. We've exceeded our goal for this enrollment period, but it's not working at a level that I would call acceptable for when November comes around.
And the state will have until November, the beginning of the next enrollment period, to complete the switch out for the Connecticut system, whose website was also experiencing major problems today. In the meantime, Congressman Harris says the Inspector General of the Department of Health and Human Services has, at his request, launched an investigation into how things went so wrong in the old line state. Brett?
James, thank you.